Hi all. If you are viewing this presentation, I believe you must be a mental health professional or a health professional working in the frontline support for the COVID affected. The purpose of this presentation is to highlight what one could go through while working with the affected day in and day out. This is what we call as vicarious trauma. Now, what do we mean by vicarious trauma? Is the cost of working with people who have experienced trauma or suffering. So it must not be easy to go in there for so many days together and see the suffering of the people in these times. This viewing of someone else's suffering could lead us to feel overly empathetic towards them and could sometimes also lead to depletion of our own energies. And this depletion of energy, because of what we are seeing someone else go through, is what we call as vicarious trauma. Now let's see who could be affected by vicarious trauma. Obviously, the health professionals dealing with patients in the front line are the first people who could suffer from such indirect trauma. The paramedical staff, the social support workers who are continuously engaged in, let's say, providing welfare programs to large crowds of people, the last rite performers who are employed to dispose the last remains of the affected may also undergo some kind of shift in energies when they see such large number of bodies being disposed of. Mental health professionals engaged in listening and emotionally supporting the affected and their family. Service providers engaged in supplying essential services, or anyone who's witnessing the trauma of even a stranger. So you could be a neighbor who has just witnessed someone being affected through COVID. You could have witnessed their journey, you could have witnessed their demise, and somewhere you could have been affected by the suddenness of all of it. And then we need to understand if you would have any symptoms of vicarious trauma. Now, what are the symptoms that we could watch out for? Mentioned here are some symptoms. Some of them are physical, some emotional, and some even in terms of thought patterns where we begin to maybe question our life's purpose, question the negativity of it all, and wonder whether things would get better at all. So if we have any of these symptoms occurring from engaging with the COVID affected on a daily basis, then maybe it's time to just pause and take care of ourselves. Now, what do we do? Opting out is not an option. Not providing the service is not an option. So how do we cope? We need to primarily understand that taking a break is okay. Pausing is okay. Refreshing yourself and regenerating yourself is fine. Providing self-care is absolutely necessary. Believe in oneself and believe that you're doing your best. If things do not turn out the way you wished for with regard to a particular patient, then it's not your fault. You have done what you could. Vicarious trauma is real. It is as severe as going through trauma oneself and needs to be acknowledged, addressed, and healed. I hope that healing others begins with healing yourself. Thank you.